Why is a skull flap used during a brain tumor craniotomy? Imagine needing to access a delicate part of the brain to remove a tumor or treat an abnormality. A craniotomy makes this possible by carefully removing a section of the skull. The piece of bone, called a skull flap, is temporarily taken out to give the surgeon a clear and safe pathway to the brain underneath. This approach is essential because it allows the surgeon to see and reach the tumor directly, which is much safer than trying to operate through the skull without removing it. The removal of the skull flap is done very carefully to avoid damaging surrounding tissues and to create a controlled opening for the procedure. Once the surgeon has completed removing or treating the tumor, the skull flap is put back into place. Securing the bone helps restore the natural shape of the skull and protects the brain from injury after surgery. Replacing the skull flap also reduces the risk of complications like infections or fluid leaks. This process of removing and replacing the skull bone is a standard part of many brain surgeries involving tumors. It provides a balance between giving the surgeon access to treat the problem and protecting the brain during and after the operation. Using a skull flap during a craniotomy offers several important benefits. It gives direct access to the affected areas of the brain, which is crucial for precise tumor removal or biopsy. It also minimizes trauma to the brain compared to more invasive methods that might involve more extensive manipulation. Restoring the skull after surgery helps maintain the normal structure of the head, which is important for healing and overall health. This technique is carefully planned and executed to maximize the chances of removing the tumor successfully while preserving brain function and reducing risks. In the context of brain health and cancer treatment, the use of a skull flap is a well-established, safe, and effective surgical approach. It allows neurosurgeons to perform complex procedures with precision, aiming to remove as much of the tumor as possible while protecting critical brain areas. Every step is designed to support recovery and minimize complications, making it a vital part of modern brain tumor surgery. Always remember, if you or someone you know is facing brain surgery, consulting with a qualified healthcare team is essential to understand the best options for individual needs and circumstances.